if I grab your name and date of birth real quick so we can get into our exam? Excellent. And is that your preferred name? How do you like to be addressed? Wonderful. So, I'm here to perform a neurological examination with you today. This is going to involve looking at your cranial nerves. We're going to look at your motor nerves, sensory nerves, autonomic system, blood flow. We've got a lot of moving parts and pieces for this one. Before we get right into it, do you have any questions at all? Okay, wonderful. So, for the purposes of this exam, would you mind if I touched you? Excellent. So, let me grab the first test. For our cranial nerve number 1. So, I am going to have you just take a little smell here. We are testing the olfactory nerve, which governs your sense of smell. So, if you could just take a little smell right here. Shouldn't be too strong. Good. And what is that? Orange. Good. We will grab another cap. And if I could have you just occlude this side. Yeah, here, I'll just hold right here. And if you could take a smell of this one. Deep inhale. Good. And what was that smell? Vanilla. Wonderful. And the other one, I'll just go ahead and occlude the other side of your nose. Right in here. And if you could just take a smell of this one. Deep inhale. What does that smell like? Strawberry. Good. That tells me that your sense of smell is intact. And we're going to move right along to all the cranial nerves regarding your eyes. We have the optic nerve for visual acuity, and we have the oculomotor, the trochlear and abducens, 3, 4, 6. These are going to be for eye movement. So if I could just have you take a look at my finger here. Right? I'm just going to have you follow the finger. Very easy test. Good. But very important. Just keep following my finger, using only your eyes, without moving your head. Good. So we're going to test the eye movement, as well as your peripheral fields. Good. Over here. Going to be a bit random, but just track my finger as best as you can. Wiggle up here. Good. Over here. Down. Over here. Good. How about right here? Here. Good. Right back here. Right here. Here. Right here. I'm able to see your accommodation reflex as well. Good. That tells me that your eyes can focus on objects up close and in the distance. Good. So now I'm going to have you focus on my nose right here. And I'm just going to have you tell me when you see my fingers wiggling here. Just keep focusing right here and out of your peripheral vision. Just tell me when you see my fingers wiggle. Good. Yep. Good. Yep. Good. Yep. Excellent. Good. Yep. Good. I'm trying to slip you up a bit. Good. There we go. Excellent. So I'm just going to have you cover one eye here. Cover one eye. I'm going to cover the same, and just tell me when you see my fingers come into view, all right? So just keep focusing right here. Tell me when you see my fingers, like that. Good. Good. Very good. Yep. Good. Yep. And now switch to the other side. So cover this side. Just keep focusing right here. Just tell me when you see my fingers. Good. Good. Excellent. All right. You can go ahead and uncover your eyes. It'll be just a moment. Wonderful. So now we are going to work with cranial nerve number 5, the trigeminal nerve. So I am going to grab a special tool out of my Trömner Neurological hammer here. So right in the base, there is a handy compartment. Just unscrew this. And get a little tool with a soft brush and a little metal tip here. So I am going to just test these on your jaw here so you know what they feel like. This is going to be the soft touch. And this one is going to be our sharp touch here. So we have right there. That's the sharp touch. So if I could just have you close your eyes and tell me whether you feel the soft or the sharp touch. Sharp. soft, sharp, soft, sharp, sharp, soft, soft, sharp, soft, good. Sharp, soft, sharp, soft, soft, sharp, soft, sharp. Good. Now we are going to take a small detour, and we are also going to test the sensation on the rest of your body as well. So, do this. I have a little pinwheel tool here. It'll be much easier to feel. I also have this blunt edge right here. I'd just like you to tell me sharp or blunt. So I'd like to test this on your arm. So this is going to be sharp. This is going to be the blunt, right? Good. So go ahead and keep your eyes closed, and I will just randomly do the sharp. Good. Or the blunt. Excellent. Sharp. Blunt. Sharp. Blunt. Good. Sharp. Blunt. 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 Sharp. Sharp. Blunt. Sharp. Sharp. Blunt. Blunt. Good. Excellent. And now I'd like to test cranial nerve. Number 7, the facial nerve. This is going to have a lot to do with your facial expressions and your ability to make them. So if I could just have you listen to the commands that I'm going to give you and follow them to the best of your ability. So if I could have you smile real wide, show your teeth. Good. If you could close your eyes real tight. Good. Can you puff out your cheeks? Excellent. Raise your eyebrows. Good. And can you open your eyes real wide? A little odd, yes. Very good. And can you frown for me? Excellent. So facial nerve looks great. We're going to move on to the vestibulocochlear nerve. I'm going to bring out some tuning forks for that. Let's start right here. So if you could just tell me what side you hear the tuning fork on. Good. And the next one. Good. You're doing excellent. And one more frequency. Good. Now we are going to, again, switch gears. This time, we're going to use the tuning forks. on your body. So I will strike the tuning fork and I will put it in different areas of your body. When you feel it, just say yes, okay? Good, just like that. Okay. Mm-hmm. Good. Good. So you can sense vibration just fine. Now we'll come back to the cranial nerves for the glossopharyngeal, the vagus, and the hypoglossal nerves. 9, 10, and 12. So I am just going to have you open your mouth real wide. Good. And can you stick out your tongue? There you go. And I could have you just say, ah. Good. So we have the uvula movement there. Go ahead and close your mouth. If I could have you stick out your tongue, just straight out. And can you move it to the side? To the other side. Up. Down. Excellent. And then put your tongue back in your mouth and take a dry swallow for me. Good. There we go. And I haven't heard any hoarseness in your voice at all. And all of that was normal, so I don't suspect any issues with those nerves. And to wrestle my stethoscope a bit. And now I'm going to listen to your carotid artery, and I'm going to listen for something called a bruit. This is an audible heart murmur. So I am checking the blood flow to your brain. So I'm going to put the stethoscope on your neck. I'm going to have you take a deep breath in and hold it while I listen, so that I'm not also hearing the flow of air through your throat. And then I'll have you exhale. Right. Now, if I could have you just inhale, hold, exhale. Exhale. only need this for now. There we go. So, no bruises. Let's get into the extremities a little bit. We're going to finish up the cranial nerves with cranial nerve 11, the accessory nerve. So I'm going to have you do a couple of shoulder shrugs for me. Real easy. Just go up and down. Up and down. Good. Let me just take a little peek here. We're going to be looking for muscle wasting. I'm also going to be testing some muscles. Okay. All our muscle groups in here look good. All right. Now I'm going to take a feel around your arms, your hands. Good. Legs. Feet. Good. So we're going to do some tests now. So if I could have you clench up your fists and open your hands. Clench, open. Good. Can you make a tabletop with your hands? Okay. Can you roll your wrists in and out? A lot of little cracking there. And if I could have you just turn your hands in and out, up and down. Good. Can I have you bend at the elbow? Just bring your arms up. Good. Can I have you make these sort of bars with your arms where your upper arm is parallel or perpendicular and your lower arm is parallel to your body? Good. I'm going to try to push you. I want you to resist me. I'm going to try to pull you towards me, and I want you to resist me. Good. Can I have you roll your shoulders backwards and forwards? Good. Can I have you bring your arms up and all the way above your head? Can I have you bring them all the way back behind your body? Okay, you go out to the side and then all the way up, backs of the hands touching. Very good. Any problems with any of these? No. Okay. So for the legs here, I am going to have you kick out your lower legs. So bend at the knee. Just give me a couple kicks here. Good. I'm going to press down on your thighs. I'd like you to push up against me. Go ahead and push up. Good. And I'm going to bring my hands under your thighs and try to pull up. I want you to push down. Good, there we go. Now I'm going to try to press the foot down. I want you to press up against me. Good. I'm going to try to pull the foot up. I want you to press down. There we go. Can you move your ankles in a circle inwards and outwards? Can you bring them in, out, Go up and down. Good. And can you bring your legs from in front of you outwards? So turn at the hip, one leg at a time. There we go. Any problems with any of those at all? No? Okay, wonderful. Oh, let me just make a note of that. And then we will move on to position sense. Work a little bit more with your fingers and toes. So, I'm going to move your finger either up or down. I'd just like you to tell me whether it's up or down, alright? So, if I could have your finger here. So, this is up, this is down, alright? We have up, down, alright? So, just tell me which way it's going. Down, down, up, down, up, 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 down. Good. Other side. This is up, this is down, up, down, right, up, good, up, down, 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 up, down, down, up, 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 good. And for your toes, we're going to do the same thing. So, if I could have this side. So, this is up, this is down, up, down, alright, up, up, down, up, down, 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 up. The other side. This is up, down, up, down. Good. Up, down, 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 up, down, up, down, down. Good. Now we'll get into a bit of coordination. So this is called the nose finger test. I am going to have you touch your nose and then touch my finger. Nose, finger, nose, finger, finger, nose, nose, finger, finger, nose. Just like that. So, if I can have you touch your nose and then touch my finger. Good. Nose, finger, nose, finger, finger, nose, nose, finger. Good. Now I'm going to be moving this around while you're doing that. So you're going to touch your nose and then my finger, just like this. Alright? So, start at your nose, finger, nose, finger. Just keep touching your nose and then my finger. Good. Touching, if I could have you close your eyes, and I'm going to have my finger right here. It's going to stay put, but you're going to touch your nose and then my finger. Right? So go ahead, nose, finger. Eyes closed. Good. Just get it a couple times there. There we go. So that part of the coordination test. We're going to take a bit of time for you to relax. And I will be testing your reflexes. And after that, I'm going to test your blood pressure while you're sitting down. We're going to do this twice. We'll do it while you're sitting and then while you're standing, so we can check for dysautonomia. So, I am going to elicit a few different reflexes from your arms, your legs, and your feet. So if I could have you just lay your arm across your thigh here, palm up, and let it relax. I am going to be holding on to your elbow with my thumb in the crook of your elbow, and I'm going to strike the tuning fork, or the hammer here, on my thumb. Now, for example here, if I cup your elbow and strike my thumb, just like that. Alright. Other side, if I can have you just lay your arm across your thigh, and I'll grab your elbow here and move you where I need you to be. Good. If I could have you continue to put your arm over your thigh, I'm going to strike the hammer at the back of the elbow this time. So I'll come in on this side. Good. Okay. And now we'll move to the knee. You can relax the arms, and I will just have you allow the legs to relax. Let them hang freely. We're going to strike one, and the other. Good. And for the ankle jerk reflex, I'm just going to have you let me hold onto your foot, let me maneuver it, and I'll be striking the Achilles tendon right behind the ankle. So, just let me hold your foot here. The other side. Good. That's all we need from that. We're going to bring the stethoscope back in now. And we're also going to need the sphygmomanometer, the blood pressure cuff, right here. have you relax your arm. I'm just going to put the dial right in there so that holds on. It's got a little clip. I'm going to put the stethoscope in the crook of your elbow here. And let me see. Is this all? Nope, it's not tightened up. So I'm going to tighten the bulb there so no air escapes. And we're just going to very slowly. Let the air out of the cuff. Get our diastolic pressure. There we go. We'll do that one more time here. Tighten the bulb. We're going to keep the cuff on, and now I'm going to have you stand, right? So go ahead and just stand up. Okay, let's measure that again. All the way. One more. Tighten the bulb. There we go. Looks like there isn't any dysfunction of the autonomic nervous system. We've got just a couple last tests for you while you're standing. So if I could have you outstretch your arms to the side and close your eyes. Now, I will keep an eye on you. You're not going to fall. And I'm going to have you just take a few steps forward. Right? 1 step, 2, 3, 4. Good. And you can open your eyes. So that looked good. Balance looked good. We're going to do a few walking tests. I'm going to have you walk to the end of the room there and just do this normally, how you normally would walk. Good. And if you could come back walking on your toes. come back walking heel to toe. So your toes touch your heel as you walk forward, just like that. Good. Go ahead and take a seat. All right. Nerves. Intact. Motor nerves. Sensory. Autonomic system, as well as the blood flow to the brain. All looks normal. Do you have any questions at all? No? Very good. Yeah, I know it's a lot of seemingly strange tests, but really it is a wonder that we can test things very simply and be able to figure out if there's something wrong. It makes it very accessible for a lot of people, and luckily a lot of these can also be modified for people that have less mobility or are bedbound or are injured, things of that nature. So really it's a blessing that some very silly tests like sticking your tongue out can tell us about the condition of your neurological system. So I'll go ahead and sign off. And that will complete your neurological examination. I'd like to thank you so much for coming in today to allow me to evaluate your neurological system. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon, or I also have a Ko-Fi